Hey everybody, my name's Mike. Welcome to the Human Optimization channel, the channel where I discuss my journey and hopefully your journey too through human performance optimization, which is the use of science-based tips and tricks to get the very best out of ourselves, whether that be work, rest or play. Today's topic will be cold water therapy and more specifically cold water immersion. So first of all, medical disclaimer. If you have any kind of health issue which may put you at risk with cold water, then I suggest you seek proper medical advice first. So why should we do cold water immersion? Well, we grow through difficult, stressful times. When we go outside of our comfort zone, that forces adaptations and specifically our stress resilience. So all those everyday stresses and strains will become easier to manage them. We grow through difficult times. Nobody knows this more than the Special Forces, and if you imagine the US Navy SEALs, they spend a significant time getting cold and wet in the surf, as do our Royal Marines here in the UK. So what that does is twofold. First of all, it gives them that discomfort, and you have to be comfortable being uncomfortable. So there's a mental fortitude element there, but also they're going through an incredible amount of physical exercise, and those short durations in the cold water helps repair their bodies. So Ross Edgley is a renowned British sports physiologist, sports scientist, and he's recently swum all the way around the UK, and I think he's currently going around Iceland. He says stress forces adaptations, and I couldn't agree with him more. When we go through small inoculations of stress, it's a process called hormesis. It gives us a little inoculation of stress in a manageable and safe way, so we can then manage other stresses in our lives easier. So, why should we do these things? Why should we do cold water therapy? Well, first of all, as I say, it builds our mental resilience and our fortitude and our ability to handle stress. It also helps with pain reduction as well. Some people have said that it scrambles the pain signals from the body to the brain. But I think the other thing is the fact that it reduces inflammation. Inflammation can lead to a myriad of health issues. The primary health issue that it can help with inflammation is reducing the risk of having heart disease. Heart disease is the #1 killer here in the UK, but also worldwide. So if we can do something to reduce our risk of heart disease, then surely it should be worth looking at. So these are some of the reasons, and we'll go into some more later on, of why we should be doing cold water therapy. So what is cold therapy? Well, as I said before, it's using a microdose of stress to force the adaptation to allow our bodies and our brains to cope with that stress better. We were said before that it's a process called hormesis. So our body has a lot of thermoregulatory capacity. It has a lot of different elements of our body that help to manage our temperature. We have temperature sensors in our skin, and when we immerse ourselves in cold water, the temperature sensors in our skin send an alert signal to the medial preoptic area in the hypothalamus of the brain. You can think of that as the thermostat. That then registers that there's a potential threat to our survival, and our fight, flight or freeze systems kick in. Our limbic system, the nervous system, and the particular area of it is called the sympathetic nervous system. That's our fight or flight system. What happens is the body senses this threat and it produces the stress hormones adrenaline and cortisol, but also a cascade of neurotransmitters called catecholamines. And what that does is it produces a small level of stress to help us to try and conquer, to try and defeat whatever the perceived threat is. And in this case, it's the threat from the cold water. So, what happens when we immerse ourselves in cold water? Well, the first thing we do, we take a deep breath in, and again that goes back to our survival instinct. One of the biggest threats that we face in cold water is obviously that of drowning. Drowning is going to be ultimately a lack of oxygen. So our body takes a really big deep breath in. It's called a gasp reflex. And what that's wanting to do is maximize the amount of oxygen that we've got in our system. One of the misconceptions that I think that there is about cold water immersion is that people say that the water has to be absolutely freezing cold. I don't necessarily think that's the case. As long as we get the gasp reflex, I think our physiology will give us the result that we want, which is that little bit of hormesis, that little bit of stress that goes in. The next thing that we're going to find is with our reduced level of oxygenation, our cognitive capacity, our ability to think can be diminished by up to 80%. And that's obviously where we've heard of with hypothermia. One of the first signs of hypothermia is confused state, and this is where this comes in. What we can find is also that we get a lack of physical coordination. Our fine motor skills are much reduced. A really good way to test for hypothermia is if you can touch your thumb to your little finger. That's quite a good test. If you can't do that, then your fine motor skills and your coordination is reduced to such a degree that you are at risk or already in hypothermia. So that's quite a good one. We mentioned before the release of the stress hormones adrenaline and cortisol and the neurotransmitter catecholamines. What that does is it boosts our alertness and our focus. For somebody like me who's autistic with attention deficit disorder thrown in as well, one of the main benefits I get from cold water immersion is that boost in my focus and my level of alertness, and it makes me feel much more awake because I also have chronic fatigue syndrome. So that's probably the main benefit that I get. What happens is we enter a state of what Hans Selye, a renowned psychiatrist, called eustress, which is good stress. You have distress and you have eustress. So we enter into this state, and what assists with that is the release of dopamine. You may have heard of dopamine as the feel-good hormone or something like that. Professor Andrew Huberman tells us it's not really a hormone, it's a neurotransmitter, and it's not really about feeling good, it's about reward. So there's two types of dopamine. We've got the short, quick fix dopamine, which is where we do things like view social media, smoking cigarettes, taking drugs, eating chocolate, things like that, the quick fixes. But what you find with those is you get a really big spike of dopamine that happens very, very quickly. And then to bring ourselves back into homeostasis, our bodies then process it very rapidly and we overshoot and we end up feeling worse than we did before. The second type of dopamine hit is a much longer dopamine hit, and we get that when we do things that are difficult for us but that are ultimately healthy. And this is a really good example of cold water therapy. It's very uncomfortable, but ultimately it's good for us. And the body gives us this reward of dopamine to make us feel good, to motivate us to do it again. And to go back to Professor Huberman, he says dopamine is a motivating substance. It motivates us to do these things again that are ultimately good for our health. Another thing that happens in an attempt to protect our internal organs, our vital organs in our torso, the blood vessels in our extremities dilate they constrict, they get smaller. It's called vasoconstriction. And what that does is it forces all the blood, the warm blood, back into our torso to keep our vital organs nice and warm. But because of the fact that our blood vessels are constricting, what that can do is it can aid with their elasticity. Where they're more elastic, you can prevent things like arterial hardening. And arterial hardening is one of the things that can lead to cardiac problems. And we were mentioning before about the prevalence of heart disease. So by getting our blood vessels constricting and dilating, we can help reduce the chance of getting that heart disease issues. The other thing that vasoconstriction does is it helps reduce inflammation. And we were mentioning before that inflammation is one of the biggest risk factors for things like diabetes and cardiac issues as well. The other thing it does is it can get rid of pathogens, which is a bad bacteria, and part of the inflammation process, particularly in things like our skin, is called inflammaging, which is where it accelerates the aging process. So if we can reduce inflammation, we can reduce inflammaging, making us feel and you look younger than we are, which is great. We mentioned a minute ago about the ability to defeat pathogens, okay, the illness causing bacteria. Obviously we have lots of good bacteria, particularly in our gut, places like that, but obviously you have bad bacteria, and that's what we call pathogens. Numerous studies have shown that people who take a cold shower on a regular basis have up to 30% fewer sick days, which is a great thing. But it also demonstrates the physical effects that we can get from the cold water therapy. Another thing that happens is the white fat cells, the adipose tissue. White fat is your bad fat. What happens is when we immerse ourselves in cold water, the white fat, the bad fat, gets transformed, if you like, into brown fat, which is good fat. We can use that brown fat to metabolize to help keep us warm. And talking of the metabolism, when we go into cold water, our metabolism raises. And those of you who do a lot of exercise will know that exercise raises your metabolism, okay? Your resting ability to burn calories. So by doing cold water therapy, it can help people with weight loss to a degree. So there's loads of things that happen when we do cold water immersion and cold water therapy. Right, back again. All that talk of being cold. I've just had a sauna at home. Yes, I love my home sauna. Anyway, right, where were we? How does immersion different from a cold shower? So first of all, what do we mean by immersion? Immersion is when you're submerged up to the neck. So everything is covered. I've got an ice bath. So if you imagine the difference between having a bath and then having a shower. So what does that mean in practice? Well, when you're in the shower, there's only a portion of your body at any one time that's got covered in water, if you like. So if the shower's in front of you, it's coming on your face, obviously your head, and it's dripping down your body, but your back's not being affected. It's not in contact with the water. Your arms are probably not being in contact with the water, and most of your legs are probably not being in contact with the water. So when you're submerged, everywhere apart from your neck upwards is going to be in contact with water. And water transmits heat 4 times better than air. So that's kind of why we do water immersion or water therapy as opposed to just going and standing out in the cold. So that's the first one. Again, to go on to Professor Huberman, he says that there's areas of the skin called glabrous areas of the skin. And what that means is there's the cheeks, the palms of the hand, and the soles of the feet. Those are the glabrous areas. And what they have is they lose heat much more rapidly than other areas of the body because the proximity of the blood vessels to the skin, it gives off the heat from your body in essence, which is traveling via your blood system, and then it comes out much more effectively that way. He does a really good video on the glabrous skin and how to cool down quickly. So in an ice bath, in an immersion environment, you can have those areas constantly, well, apart from your cheeks aren't being constantly, unless you're facing for a long time, which is probably not advisable. But your soles of your feet and your hands will be constantly submerged, so you'll shed heat from your body much quicker. So that's the first difference really between the shower and the immersion. The second difference is most showers here in the UK will probably only get down to about 15 degrees Celsius. Now my ice bath is out in the garden, so it's subject to ambient temperature. But the coldest that's ever been is 0.1 degrees Celsius. And it gets down to that fairly regularly in winter, and I end up having to break the ice to get into it, which is really good because it makes me feel really, really grr. So that's it's quite good from a positive mental point of view when you think, right, okay, I'm going to have to break the ice to get into this, and it's really good from that point of view. It goes back to that dopamine reward. It's going to be really hard, really uncomfortable, but I know it's going to be really good for me, so you get a really good dopamine hit for the rest of the day. So we talked about that. The other thing I'd like to say is that the studies that are out there that talk about cold water therapy, all of them that I've seen available are to do with immersion, not with a shower. So we don't actually fully understand how the shower will work in that way. You still get a gasp reflex. So as we said numerous times now, that's still going to give you a benefit. Probably not as much of a benefit as immersion though. However, money, honestly. Space is another one. If you've got a small apartment, a flat, you've probably not got anywhere to put a cold water bath, a tub, like my one. So you're going to have to use a shower. I mean, it's better than nothing is what the takeaway would be really. But if you can afford, I think my cold bath was about £80, so it's not hugely expensive, and I use it every day, absolutely every day. It comes down really, I would say, to space is going to be the big thing, limiting factor there. But if you've got the space and if you've got £80, get yourself a little ice bath. It's really, really worth it. There is some other little bits that you might want to get with it, but we'll discuss those later on. So in essence, that's the difference between a shower and immersion. So we discussed what it was up to the neck. You're going to get the glabrous areas of skin. You're going to get better heat transfer because all of your body, apart from your head, is going to be in contact with the water, which is likely to be colder than it would be in a shower anyway. Okay, so when not to, with all of these great benefits of an ice bath and cold water immersion and cold water therapy, when might it not be a good idea? There's two instances. First of all, if you have cardiac problems, the cold shock can cause extra stress on your cardiac system. And worst case scenario, you could end up with a cardiac problem such as a heart attack. So if you've got any kind of a cardiac problem, not a good idea. The second is if you're training in the gym for muscle hypertrophy, you want to get your muscles bigger. Part of the process of your muscles increasing in size, that hypertrophic response, is inflammation. You want inflammation. Inflammation is good if you're after bigger muscles. If you get into the ice bath immediately after or prior to training, it blunts what's called the mTOR pathway, which is part of that process of building up the muscles and that inflammation. Where the ice baths do come in helpful is to reduce post-exercise muscle soreness, to allowing you to get back to training again. So that's where you'll see athletes do use it, but they might be doing 3, 4, 5 sessions a day, and they're not. Their prime focus is not to get bigger in size; it's athletic performance. And if they get into an ice bath and it reduces that inflammation and speeds up the healing process by reducing inflammation, they can get back to training again quicker. So if you do want to do hypertrophy training and an ice bath, you need a minimum of 4 hours in between your ice bath and your gym session, your training session. That should give you a bit of time for the effect from the cold water exposure on the mTOR pathway to have diminished to a level where you can get that hypertrophic response. So when should we do our cold water therapy? Well, ideally when we wake up, either in the morning or if you're a shift worker, again, when you wake up. And the reason for that is with your circadian rhythm, the cold is going to wake you up, okay? So you want to get that alert, fresh feeling first thing in the morning to help energize you and wake you up. You don't want to be doing that before going to bed. The other reason is when we wake up in the morning, we've got higher levels of adrenaline and noradrenaline. And when we get in the ice bath, they're amped up even more, which will give you even more of an alertness. The third thing is when you do an ice bath in a fasted state, when you've not eaten, it will raise your metabolic rate even higher. And again, like we said before, your metabolic rate is how many calories you're burning at rest. So if you do it before breakfast in a fasted state, your metabolic rate will be even higher. So if you're aiming to do a bit of fat loss, again, Do it in the morning in a fasted state. It will help wake you up and it will raise your metabolic rate. Outside now, and we'll talk about what kit and equipment that you might need. Well, obviously the first thing is your ice bath itself if you're not going to do a shower. There you can see mine. I'm 6'3". I got an XL. It cost me about 80 quid, so it's nice and cheap. First thing is cleanliness. You're going to need to clean the top and you're going to need to clean the bottom. To clean the top, I obviously get lots of bugs and stuff. Obviously it's got a cover on it, but you're still going to get little bits that go in it. A cheap sieve. Scoop the bits out, flick them out that way. That'll help keep the top nice and clean and tidy. To clean the bottom, I use a vacuum designed for a hot tub. This one was about £39.99 and it does a great job. It just keeps the bottom nice and clean. Because what you'll find is the chlorine tabs, which we'll talk about in a second, they tend to sort of come and settle on the bottom. And also you just might get like bugs and stuff just sinking to the bottom. So you need to clean the top with the sieve and the bottom with something like the little vacuum cleaner there. You can also get these things, you know, for cleaning fish tanks and stuff like that to get to the bottom. So we mentioned chlorine. Obviously to keep it nice and clean, I use chlorine tablets, again, small ones that are designed for hot tubs, fairly cheap. And what you do is you put them in this little mushroom here in the top. They sit in there, in fact there's one in there already. It sits in there. Water comes in through this little aperture and then you get a nice slow release of chlorine. You can get little test strips that you can do just to make sure that the pH and the chlorine is where you want it to be. To be honest, I don't really use them. If it smells really chlorine-y, I just might leave the cover off for a few hours and that'll help the chlorine kind of evaporate off. But you need the chlorine in there to stop it from going green and manky. I live in a forest and it would get very green and very manky very quickly. The next thing you're probably going to want is some kind of thermometer to know how hot or cold, rather, the water is going to be, because that will dictate how long you're going to spend in there, and we'll talk about that coming up. Two more things you'll want. Number one is some form of timer. Now it can just be your watch if you've got a digital watch or something like that. To be honest, I use the Wim Hof app. I really like that because he talks you through it and he keeps you motivated and he tells you how well you're doing and all these sorts of things. So I use that, but again, some way of measuring how long that you've been in there for. Now the last piece of equipment, probably the most important. You need a rubber ducky. Thanks, Paddy. That one's for you. Okay, so we've talked about what cold therapy is. We've talked about the difference between immersion and showers. We've talked about the benefits. We've talked about the risks. We've talked about when to do it. We've talked about what kit and equipment we're going to need. So we're all raring to get cold now. But how do we do it? Well, the first part is the prescription. So the first question with the prescription is how cold? Unless you've got a really expensive system that you can manipulate the temperature and make it cold, and they are really expensive, or you spent a fortune on ice bags to put in, it's pretty much going to be out of our control. As I say, my ice bath, as you saw, is out in the garden, so it's very much subject to ambient temperature. If you're going to do showers, it's again subject to the temperature of your cold water tank. Mine's in the loft. So in essence, how cold for most of us isn't going to be much of an equation. But there are individual tolerances, things like how your body manages the cold, things like your metabolic rate and how it's able to convert those brown fat cells we talked about before into heat for you. Another issue is if you've ever had hypothermia. If you have had hypothermia, then you're more susceptible in the future to getting hypothermia. And then the final part for it is your experience with cold. If you do cold immersion or cold therapy regularly, then your body's going to be much more able to adapt to it when you get in. So you're going to have more capacity to take colder water. So, but for most of us, how cold isn't really going to be in our control. What we can do is then move on to the next question of how long, and we can use the information of how cold using our temperature, our thermometer if we've got an ice bath, to estimate how long that we need to be in that water for. So the instructions that came with my tub was for every 1 degree Celsius, 1 minute of immersion. I find that really works really well up to about between 5 and 7 degrees Celsius. So when I was mentioning before, and it was 0.1 degrees Celsius, 1 minute, and then I get out, and again 2 degrees, 2 minutes, etc., etc., etc. That's one way to do it. To go back to our old friend Professor Huberman, he says when we build up our resilience, you want to get longer and longer and longer in the same temperature, if that makes sense. So when we go to the gym and we do our bench press or we do our back squat or whatever, as we're exposing ourselves to that stimulus, we get stronger and stronger and stronger. And in the gym, we put more and more weight on the bar. And then that's how we can keep eliciting a response to adapt. So if we were to say, let's always do 1 minute per 1 degree Celsius, what's the added stimulus as our body's got more and more capable for that? Well, what Huberman says is you can count walls. A wall is a bit where you go, I really, really want to get out of this water now, but you mentally force yourself to stay in. That's a wall. The first wall I have is when I get down into the immersion. You think, oh gosh, this is going to be uncomfortable, and then you get yourself down. And then after a bit of time, you think, oh, I could really do with getting out now. That's another wall, get through it. What he says is for that adaptation bit to evolve, if you like, you can increase slowly over time the number of walls that you push through. However, there is a safety element with this. With people who've got a huge amount of willpower, you might find those sorts of people doing too long. The question that Huberman says that you should ask yourself is, this is uncomfortable, can I stay in here safely? If the answer is yes, then keep going for those walls or for that time that you've allotted for yourself. If you think, no, I can't stay in here safely, then it's definitely time to get out. The number one rule, safety first. Okay? So that's how we can do it for how long. So the next question, I suppose, would be how often? Well, what we can do is we can say minimum of 3 times a week. I say I generally do it pretty much every day. But as long as you accrue 11 minutes, according to Professor Susan Solberg, renowned in this area, as long as you accrue about 11 minutes over the week, then you're going to be pretty good with it. So it doesn't need to be hugely long in there to get the benefits. You're better off doing multiple shorter sessions than one 11-minute session per week, because that's going to give you a drip feed stimulus all the way through. So how cold? Generally going to be, hopefully, most of us, I'm going to say, out of our remit. How long? We talked about that. And then how often? Minimum really 3 times a week, but trying to accrue 11 minutes over the week. Right, so we've got all our kit, we've got all our equipment, we know how cold the water is, we know how long we're going to spend in there. What are we going to do? How are we going to do it, the session? Well, let's break it down into 3. Pre, peri, and post. Pre is obviously before. Don't overthink it. If you think it's going to be a negative experience, it will be. Lean into it and enjoy it. Studies show us that when you think about something that's going to be difficult and you voluntarily put yourself into that position, different neurochemicals are going to be released than if you're going to be forced into that position. Okay, so enter into it with a positive mindset. It's going to be uncomfortable, but you're going to get so much benefit out of it. Think about how you'll feel when you get out, that sense of reward and motivation to do it again from the dopamine. Think about how alert and refreshed you're going to be. Think about the benefits from your longevity and the youthfulness that you'll get from it. Okay, so that's before. Don't overthink it. Peri, once you're in there, breathe. Okay, Ross Edgley, we mentioned before, he says focus on your breath and your physiology will follow. Okay, and he's absolutely right, because if we do nice, deep, slow, controlled breaths, what's going to happen is we're going to kick in, hopefully, our rest and digest parasympathetic nervous system, because as we're in the water, our vagal nerve is going to be stimulated, and the sympathetic stress of fight and flight will drop. And as that drops, our parasympathetic rest and digest will come up, and we'll exit the water feeling calm and all zen, and it all will be well. So breathe nice and deeply, focus on the breath. If you focus on the breath, it takes your thought process away from the uncomfortable bit. Okay, and again, that's the bit we were talking before about being comfortable, being uncomfortable. If you focus on the breath, then you're not focusing on the cold. What you'll find is the area of water immediately around you will warm up because your body's in it, and your body's going to be warming that area up. It's called the thermal layer. So once every minute or so, give the water a good stir, and then that will keep cold water in contact with your body. But don't try and fight it. Just relax, focus on your breath, lean into it, and ultimately enjoy it. It is there for an enjoyable experience. So post. After we've done our time and we've got out, what do we need to do then? Well, obviously dry yourself off is going to be the first thing. We mentioned Professor Susanna Solberg. There's something called the Solberg principle, which is always end on cold if you want to raise your metabolic rate. If you're really interested in burning off fat, what you want to do is end on cold. Don't go and jump into a hot shower or anything like that. We need to bring our core temperature back up slowly. All the blood in our extremities will be quite cold, and if that comes back to our heart too fast, that can create cardiac problems. We want to raise our temperature slowly. A good way to do that is just through movement. Don't jump into a hot shower, because what you might find is if your skin's numb, it might not necessarily feel how hot the water is, and you could possibly end up scalding yourself, as I say. So we don't want to do that. Like me, if you don't have much body fat and you're not really interested in burning fat in that way, it doesn't matter too much if we don't end necessarily on the cold in that way. So one of the things in that respect that I do, if it's really, really cold, I'll wear a hat. You'll see some people wearing woolen hats, and the idea is that our core temperature doesn't drop too low. So if you do want to use this to burn fat, then obviously the lower your temperature is going to be, the more it's going to be for you. But it's a trade-off. In the winter, it can take me a couple of hours to get back to a core temperature, and it's quite uncomfortable for that period of time. So the trade-off for me is I don't really want to burn fat, and I don't really want to be uncomfortably cold for a couple of hours. So that's why I'll wear a hat in those sorts of temperatures. So we talked about pre, peri, and post. Okay, so to wrap it all up, cold water therapy. It gives us so many different benefits. There's physiological benefits. It can reduce inflammation, making us feel and look younger. It can reduce inflammation, which reduces the risk of things like diabetes and heart disease. As said before, heart disease is the biggest killer globally. It can do physiologically, it can help promote a sense of well-being with a long release dopamine hit. It can make us feel more alert and more refreshed, specifically for people like me who have attention and chronic fatigue problems. From a mental point of view, it helps with that clarity of thought as well. There's so many different benefits for cold water therapy that we've covered all of them in the video. So there's loads from a physiological point of view. There's also loads from a mental point of view. The next point is that immersion is going to be more effective than a shower. However, from an availability and accessibility point of view, a shower is still definitely acceptable. It's absolutely better than nothing. Colder, more, if you like, is not necessarily better. Okay, so as long as we get that gasp reflex, it's going to be good for us. If we go really cold, our individual tolerances vary, and we may be going too far. Remember, safety is the number one thing. So get out there, get cold, but above all, remember, every day is a gift. It's a precious gift that we should all be embracing and making the most out of. So get out there, get after it, get cold.